Testing, testing. Now we have a quorum. Thank you all for attending tonight's meeting of the Health and Human Services Committee. Is there any additions, deletions, corrections to the minutes from the last month's meeting? Is there anybody from the public that would wish to address the committee? Moving on to resolutions.
First resolution this afternoon, authorizing agreement for provision of services to elderly of Jefferson County.
Motion, please. Mr. Ferris, second. Mr. Drake. Any discussion? All in favor? Opposed? What? That was an aye. So there's no opposed. Carried.
Appointing member to the Jefferson County Office for Aging Advisory Council.
Motion by Mr. Ferris, second. Mrs. Fitzpatrick. Any discussion? All in favor? Opposed? Carried.
Next, amending the 2017 county budget in relation to the North Country Initiative Delivery System Reform and Incentive Program and stop DWI funds and authorizing amended agreement.
Motion, Mr. Ferris. Second, Mr. Drake. Any discussion? All in favor? Opposed? Carried.
Authorizing agreement with the Governor's Traffic Safety Committee in relation to the New York State's Highway Safety Program grant.
Mr. Ferris. Second, Mrs. Fitzpatrick. Any discussion? All in favor? Opposed? Carried. I think that would be the shortest meeting of the Health and Human Services Committee with the least amount of members present also. So. Right. I would like to thank Mr. Drake for being here tonight and hope that his health is doing well and improving. So. Any other business to come before the committee tonight? Okay. Thank you very much for the department heads that are also present tonight. I'll make a motion, or entertain a motion to adjourn. Mr. Ferris, Mrs. Fitzpatrick. All in favor, adjourn. Mr. Cartman?
I'd like to call to order the September Standing Committee on Finance and Rules monthly meeting. Is there anyone from the floor who cares for a privilege of the floor? No one. Minutes from last month. Corrections, deletions, additions? Seeing none, we'll stand as presented. And then we'll move to resolutions of the Finance and Rules Committee.
Take a deep breath on this one. Whew. Resolution of the Board of Legislators of Jefferson County authorizing the issuance of the Jefferson County Civic Facilities Development Corporation of up to $99 million aggregate principal amount tax-exempt revenue bonds, Series 2017, in accordance with Section 147F of the Internal Revenue Code of 1986, as amended, in connection with certain projects for SMC.
May I have a motion, please? Mr. Nabawanek, Mr. Drake. Now that we have the motion on the floor, I would like to offer the microphone to Mr. Alexander and possibly Mr. Carmen to give us a little insight into what this is all about. Would you be willing to do that?
Legislators, as they're coming forward, I would point out that this is the third or fourth time this type of activity has taken place. I think back in 2011, we authorized this type of an organization to be established, and since then, Samaritan has had the opportunity, I suppose, put it that way, of using it on a couple different occasions, and the most recent is now what's before you. Don?
Well, it's a pleasure, first of all, to stand in front of you guys because you're the ones that created the Jefferson County Civic Facility Bond Corporation, which Bob spoke about. And it has enabled us to work in projects in the community which have brought both employment and extensive capital investment to the community, and that's obviously the purpose of what we do. Tonight, we are here to talk about the latest project that Samaritan is going to participate in. We kind of act as the term I use, it may not be correct, so David, shoot me if it's not, but we act as a conduit lender here in the sense that we are able, because of our not-for-profit status, we are able to offer these bonds at a reduced cost to the hospital, which means that they can invest further in the projects that they're talking about. And of course, Tom is here to explain those. So it's a pleasure, and I want to say this truthfully, it is a pleasure to introduce Tom Carmen, who is one of the guys in this community who has, since he came here, been working to grow it. And I've seen that example on many more than one occasion, and we're just a very small piece of trying to help them. And we'll talk about that bond issuance of up to $99 million if you have questions later on. Tom?
Don, thank you so much, and it's my pleasure to be with you this evening as well. Tom Carmen, the President and CEO of Samaritan Medical Center. And as Don noted, we are looking to issue bonds for up to $99 million. It probably will be in the mid-90s as we're all said and done. We're still finalizing all the plans based on not only the projects, but some refinancing and some debt service coverage as well. So all those numbers are coming together at this point, which is why we want that limit up to $99 million. As you look at the overall issuance, The vast majority of it is really to allow us to refinance. We've got a number of instruments right now that are financed through banks with a variety of different maturity dates. We're really just trying to bring those together and avoid the uncertainty of these bank loans and to have a longer-term instrument that we'd be able to consolidate all of our current debt. In addition to that, we're looking at about $30 million of new capital. That $30 million will go to support two different projects. The one project is a cancer center. You've seen that's actually under construction right now. We started planning for that project a number of years ago. A year ago, during the summer of 2016, we acquired some additional homes, demolished those, expanded the parking, got ready for it so that the construction on that facility could take place this year. That's about 17,000 square feet of new space, in addition to about 5,000 square feet of renovated space, coming together and allowing us to create a dedicated space for both medical and radiation oncology. It was all part of a succession plan to make sure that we had those services available into the future. We worked very closely with Dr. John Poggi. He came on as an employee of ours. He's since retired. That allowed us to recruit 3 additional medical oncologists to the community to provide that continuity of service. And as we began to think about it, we recognized the opportunity to bring those services together on our main campus. It will be in a 2-story building. I can tell you, as that building was being designed, it was really not about the building, but about the services we're trying to offer. Our group got together and began to think about how we created an environment of healing and hope. Cancer these days is more of a chronic disease. It's not something that kills everyone. And so we're really trying to provide that environment that people will find more nurturing and healing and all of that. The team actually went out and looked at different sites across the Northeast and then brought that information back, worked with a group of architects that spent a lot of time on cancer centers and came up with this design. The lower level is where the medical and radiation oncology will take place. It's also where the support services will be offered. Support services such as social work and financial counselors and nutritionists and other consultants that are necessary when we're trying to help someone with a cancer or disease. The second floor will then be mainly for infusion therapy. The lower level is more of a rectangle. The upper level is an L-shaped building or an L-shaped story on top of that, which also allows a space for a nice rooftop healing garden. So that the folks that are undergoing chemotherapy or infusion therapy who might be there for hours at a time have a pleasant environment to look out at. So that L shape has all windows in front of chairs and reclining chairs where folks will be sitting to receive their infusion therapy. So some of the $30 million is going to support that cancer center. The remainder of that $30 million is going to support our Women's and Children's Center. That will be a project that we're continuing on. It's actually in the 4th phase of our master facility plan. This goes back over the last decade. The first phase was to basically, as we removed all the surface parking, the first phase was to create the parking garage. Second phase was the pavilion that we brought online in 2010. That provided for a new emergency department, new ORs, new critical care, a med-surg unit. The third phase was coming back into the medical center, renovating some of the space, and then ultimately creating the link between the medical center and the keep home, the healing garden. We're now into the final stage, and one of the key components of it is a new Women's and Children's Center. That's actually been a couple of years in the making. We first have renovated our Level 2 neonatal intensive care unit, our NICU. Just 2 weeks ago, we opened up a brand new labor and delivery area that was in renovated space. And then we start to work on the balance of this, which is the mother and baby unit itself, as well as the pediatric unit. Unfortunately, because of the complexity of that project and the various phases that need to be done to allow us to continue to operate while construction is going on, it will take us the balance of the next 3 years. We'll also include about a 10,000 square foot new addition on the Sherman Street side of our parking or our campus. The reason for a new addition is in 3 stories is mainly to create an entrance up to the 3rd floor so that it will be easily accessible to the labor and delivery area. Right now, if someone's coming into labor and delivery, they come in on the ground level, sort of navigate their way through to find the right elevator at a very, very stressful and critical time. It's not when you want to sort of be lost in a hospital. And so we really want to create the right environment for a new mom and dad to come in, be able to park right there in a dedicated parking lot, take an elevator up to the 3rd floor. So that is one of the main purposes, but it also gives us just a little bit more flex space so that in that space we can then expand the third floor labor and delivery, maternity, the second floor, which is inpatient mental health, and the ground level, which is some of the support services, storeroom, and things like that. And that will happen beginning next spring. We'll be breaking ground for that, as well as a new loading dock, and then we'll also start the interior renovations as well, and ultimately complete that phase in about 2021. So again, a $99 million issue, or up to $99 million, probably in the mid-90s when it's all said and done. The vast majority being refinancing with about $30 million of new capital for these two specific projects. Be glad to take any questions or comments that you might have.
Any questions for Mr. Carmen, Mr. Legislator Nabalon?
Thank you, Mr. Chairman. Tom, thank you for coming tonight. Don, you as well. And thank you for the update on the pretty impressive project towards the finishing touches there. Having worked with certainly you firsthand, Tom, on the Whispering Pines and the beautiful new facility at the top of Washington Street. It was the vision that you had there, making sure that the community was served, whether it be the closure of Mercy, making sure the needs were being met, and with the 21st century outlook and stuff. And I always admired your ability, having sat through many conference calls with the Department of Health in Albany there, the persistence and the stamina, whatever it took to deal with those people, because we all know they're not the easiest people to deal with. So I commend you on that alone. So.
Jim, thank you very much. I appreciate that. And ironically, I just came back from Albany today. I was getting here just at 5:30, meeting with folks in the Department of Health. So it's an ongoing relationship, and quite honestly, we've fostered a really nice relationship with them. They've seen what we've been able to do. We've helped the department through some challenges here at Mercy, with the North Country Family Health Center, helping to create this new senior village as well. So they have a lot of respect for what's going on up here in the North Country, so we're very fortunate with that support from them.
Yes, Mr. Alexander.
Mr. Chairman, Michael, if I could add just a couple quick things. First of all, one of the questions that has surfaced in the past, and Mr. Hageman will remember, I am sure, we want to assure you that the obligation of up to $99 million is not an obligation of the county. So you do not have to repay this if it should fail. It is not an obligation of the IDA. So we don't have to repay if it should fail. And secondly, in order for the process to wend its way, we have to do public hearings so that everyone has an opportunity to express concerns or support for this type of project. So on October 2nd at 10 o'clock in our offices at 800 Starbuck, we will be doing a public hearing on this, and we would, of course, cordially invite any of you to come to these public hearings and see what, if any, reaction we get from the general public. Lastly, I want to compliment Bill Johnson, who is your ambassador, your emissary on our board, who has gotten into our activities with both feet, and we appreciate his good support. Bill, thanks so much. Any questions on the bond issuance? We'd be happy to answer them either now or as we wend our way through the process, which is underway as we speak, and in very full and in enthusiastic terms. We have deadlines to meet, and we're going to do our best to stay on track with those. So,
any further questions? Legislator Peck.
Thank you, Mr. Monticelli. Just a couple questions for Mr. Carmen, actually. The Cancer Treatment Center, there's a lot that also happens in Syracuse. So I guess, is it different? Is there specific types of cancers that your oncology department is focused on treating in different than Syracuse? And I guess I just would like a little bit more detail,
sure,
if I could.
So I think the main advantage and benefit to the residents of Jefferson and frankly the three-county area is that it will be care closer to home. We will have some of the same services that are available in Syracuse. We will also become accredited by the Committee on Cancer. That will allow us to do some basic research as well. We will not do as much as they might do in Syracuse, but there will be some basic research that's being done here. It's really intended to provide just a more convenient, high-quality service right here in our own home community for patients who are dealing with cancer illnesses. So that is the main purpose. Relative to the types of cancers, we have 3 or 4 main diseases that we care for here. prostate cancer, breast cancer, lung cancer as examples. So there are some that are probably more prevalent here in the North Country that we'll be dealing with, but that won't be limited to just those. And then we will also at some point create an affiliation, again, because of the accreditation that we're going through. We're required to have an affiliation with an academic teaching center, and we have not selected that organization. It could be Syracuse, could be Roswell, or it could be some other nationally known cancer center as well, but we will have that relationship to work with us on various protocols and research and things of that nature. So this will be a top-notch cancer center that we can all be proud of, and hopefully all be comfortable taking our loved ones to as well.
Interesting and very exciting.
Right.
One other question I had, because it was mentioned also in here about mental health center. Certainly that's something that is very needed within the community and something that's been very difficult to maintain in the community. I guess if you could touch upon that for a moment also.
Sure. So in sort of this next phase of phase 4 of renovations, it affects the third, second, and first floor of the original building of the hospital. On the third floor is where the Women's and Children's Center is. The second floor is our inpatient mental health unit. We'll only be adding a couple of beds to that, so it's not an additional capacity, not that we need it. Right now we're doing pretty well from a capacity standpoint, at least on the inpatient side, but what it will do is provide better space, provide some additional space for programming, for group therapy, for activities, and other things that the patients on the inpatient mental health unit need. Right now it's relatively tight, and patients are a little closer together, and so this will just provide a little bit more opportunity for that. I would note, though, that on an outpatient basis, not related to this project, and this is all sort of through the DSRIP, the Delivery System Reform Incentive Program, we are looking at ways that we can embed and co-locate behavioral health and primary care as well, because I think there's a tremendous emphasis and recognition that many of our chronic illness patients also have a comorbidity of a psychiatric illness as well, and so we're really trying to help treat the entire patient. So there's a lot of work going on, not just at Samaritan, but throughout the county in the community relative to that improvement of those services.
Anything further? Mr. Carmen, thank you very much for your explanation. I enjoyed the first part where the bonds are being put together to get payments. I mean, just the financial side of it. The expansion for our community is very impressive. Thank you. Mr. Alexander, thank you for coming tonight. Onward to the next, I think. Oh, I'm sorry. Oh, thank you. All in favor of the motion that's on the floor? Opposed? Motion's carried. Thank you.
Thank you all very much.
Okay, second resolution on tonight's agenda.
Payment of legislator expenses.
Have a motion, please. Legislator McBride, Legislator Johnson. Discussion on the motion. Hearing none, all in favor?
Aye.
Opposed? Carried.
Third resolution, setting time and place for public hearing on tentative budget for fiscal year 2018.
Motion, please. Mrs. Fitzpatrick, Mr. Nabawanek. Discussion. Hearing none, all in favor?
Aye.
Opposed? Carried.
Amending the 2017 county budget related to employment and training department.
A motion, please. Mrs. Fitzpatrick, Mr. McBride. Discussion. Hearing none, all in favor?
Aye.
Opposed? Carried.
Authorizing appointment to the Jefferson and Lewis Workforce Development Board.
Motion, please. Mr. Johnson, Mr. McBride. Discussion. Hearing none, all in favor?
Aye.
Opposed? Carried.
Authorizing memorandum of understanding in relation to the delivery of services in the Jefferson and Lewis Workforce Board.
Motion, please. Mrs. Fitzpatrick, Mr. Nabawanek. Discussion. Hearing none, all in favor?
Aye.
Opposed? Carried.
Last resolution is amending the 2017 county budget relative to capital projects and debt.
Motion, please. Mr. Johnson. Mr. McBride. Discussion. Hearing none, all in favor?
Aye.
Opposed? Carried. On to the resolutions from the General Services Committee.
First resolution is accepting donation on behalf of the Watertown International Airport and amending the 2017 county budget.
Motion, please. Mrs. Fitzpatrick, Mr. Nebelonik. Discussion. Hearing none, all in favor? Opposed? Carried.
Amending the 2017 county budget to recognize insurance recovery and allocating same in the Buildings and Grounds Department budget.
Motion, please. Legislator McBride, Legislator Nebelonik. Discussion. Hearing none, all in favor? Opposed? Carried.
Amending the 2017 county budget in relation to lighting improvement at the county office building.
Motion, please. Mr. Drake, Mrs. Fitzpatrick. Discussion. Hearing none, all in favor? Opposed? Carried.
Accepting donation for Sheriff's Department K-9 unit and amending the 2017 county budget in relation thereto.
And a motion, please. Mr. McBride. Mr. Johnson. Discussion. Hearing none, all in favor? Opposed? Carried.
Amending 2017 county budget to recognize insurance recovery and allocating same in the Sheriff's Department budget.
Motion, please. Mr. Johnson. Mr. McBride. Discussion. Hearing none, all in favor? And opposed? Carried.
Amending the 2017 county budget in relation to law enforcement.
Motion, please. Mr. Drake, Mr. Nebelonik. Discussion. Hearing none, all in favor? Opposed? Carried.
Authorizing agreement for the Governor's Traffic Safety Committee Stop DWI Crackdown Enforcement Grant and amending the 2017 county budget in relation thereto.
May I have a motion, please? Legislator Johnson, Legislator McBride. Discussion. Hearing none, all in favor? Opposed? Carried. On to the Health and Human Services sponsored resolution.
Amending the 2017 county budget in relation to North Country Initiative's delivery system reform incentive payment and Stop DWI funds and authorizing amended agreements.
Motion, please. Mrs. Fitzpatrick. Mr. Johnson. Discussion. Hearing none, all in favor? Opposed? Carried. There are a couple of informational items in your packet. Revenue and expenditure spreadsheet and the monthly departmental reports from the county clerk and health benefits report. Is there anything further for the committee? Legislator Peck?
Thank you, Mr. Chairman, if I may indulge, even though I'm not a member, but just looking at your departmental revenue report, the Public Defender's Office seems to have a massive amount of revenue in August 2017, or, up to 153% year to date.
Actually, it would be wonderful if it all was applicable to the current year, but what that amounts to is states slow down for a while in reimbursements on grants, and for the last 2 years, a payment's now been made. So from a cash flow standpoint, we're recognizing it now, but it's really
a matter of catch-up then.
Yeah, well, and but in a more general sense, when you're looking at those reports and you're seeing every monthly, likely if something seems out of balance, more often than not, there's probably been, for one reason or another, either a delayed payment or an advancement on a payment or something that's a little bit out of the schedule in, say, the prior year. And likely the following month, it will be just the reverse, the catch-up sort of thing. If you look at it quarterly, it probably wouldn't be as visual in terms of some of those ups and downs, but when you're looking at it monthly, that's just the one thing that does start to surface. I can think in the case of airports, another one was a little unusual this time around. It was the reverse. We aren't catching up with the revenues, and it's a matter of getting it posted. Unfortunately, in the case of the airport, one of the employees involved in that has had some illness over the summer, so a little bit behind schedule. But that doesn't mean we're losing revenue. It's just there are circumstances that tend to surface in any one particular department that once in a while looks a little out of whack. But in this particular case, it would be delightful to collect all that for this year, but it's really applicable to a couple of years.
Well, thank you very much. It's just a matter of curiosity, since it is something of a very unusual nature for a small office that, have such a large amount like that. Thank you.
Legislator Peck, I always enjoy your questions, so I don't feel like I was indulging you. Especially I like your questions when I can get the administrator to answer them. Can I have a motion to adjourn? Legislator Milonic, Legislator McBride, all in favor? We are adjourned.